Hi, ma'am. Are you there?
Yes,
Can you hear us?
yes.
Okay. How can we help you?
Well, I did go to the emergency room at the RNC. They make you wait outside. And
Ma'am, I'm having a really hard time hearing. Can you hear? You understand?
You're really distorted,
Yeah.
ma'am.
you know what
Where are you at?
hello.
Hello, ma'am.
Can you hear us?
Yes, I can.
Okay. Where are you?
I'm at home
Mm-hmm.
during my quarantine.
Mm-hmm.
I was the one that called in said
Yes.
about my breathing.
Right.
Right,
And you went to the hospital or the clinic?
Yes, I did. Hospital.
Mm-hmm.
But they said that it was okay. I was sitting outside. They just checked my vital signs. Doctor came out, listened to my lungs, and asked me what was my problem. I told her my problem. I'm having a hard time breathing. Um, I asked her if it was just an anxiety or what. So they gave me sleeping pill, and they gave me for acid reflux, but I'm having a hard time breathing. Usually, you guys should be giving me something like pump or something like that, antibiotics, but I guess not. So they sent me home.
Which?
So it's like I thought I went to the hospital for a breathing problem, and they didn't even make me go inside the hospital, and it just made me sit outside.
At GRMC?
Yes.
Hmm.
Then my daughter went the next day to GRMC because she has the COVID and she has hard time breathing. She sat outside the whole time. She took an X-ray. They told her she has slight pneumonia. Here, take this, go home. But she has a slight pneumonia. So I'm trying to understand, what are we going to the hospital for? To get help. That's why people maybe last minute coming back in. Maybe that's why people are dying, is because they've been there. Send them home. That be the cause of it? That people are dying and they say last minute upon arrival, they passed maybe because they already went to the hospital and this is what they told them to do because they're over capacity of their hospital. So to understand the governor, is it us? Is it our job, us people? Is it our job to take care of ourselves? Because they are announcing it on the radio. Go to the hospital. Go to the hospital. Go to the hospital. A lot of them, when we meet up with each other at the hospital, they're like, "I've been here before," but they send me back home. I'm back here again. I haven't even been into the hospital. That's why I said when I went to the hospital, I'm sitting outside the hospital. I never entered the hospital. And I hope they don't charge me an arm and a leg for something I did not even touch. Did not give me a X-ray. They did not give me nothing to check my chest to see if I had pneumonia. It's only because they were listening to it, and that's what they say. And I told them I'm asthmatic. So I came back home. So what I have to do, instead of me, I went and I took some more medicine to help me. Because I don't think the doctors out there are trying to help the people anymore. Because if this thing is still opening and people are still flying in and this governor doesn't realize this, I'm telling you, it's going to hurt a lot of people. It's hurting them already. Even just like the school. We have high school, middle school, we got elementary. They want the school to go back. We know about elementary. They cannot, they're hard for distance. You know about middle school, how radical they can be. High school. The middle school and high school, no. But why is it that we cannot just, you see how we're doing, how they do Zoom, like senators and everybody else does Zoom? Why can't they do that with the students for the time being? Like a regular school. Come on Zoom. Okay, today class, open your textbooks. There's a board for you as a teacher.
Yeah, ma'am, that's what they're doing now, the online learning.
I hope they're doing this, because from what I'm hearing, they open the school next week. It hurts to see what's going on, and I stay home, but I caught the COVID because I have workers that go to work, and that's where I think I caught this, is that my daughter's the frontliners too that works at a grocery store. And yet they don't get, these people that work for the grocery store, they don't get compensated for anything. They're not quote frontliners for the governor.
They are, actually, ma'am, there's federal money that came out from the ARP that allows for the governor to give premium pay to frontline workers, to include nurses, doctors, and grocery store workers.
Oh, the grocery store, my daughter still hasn't gotten anything.
Yes, the governor is sitting on the money now, but she can use it for that purpose, to give premium pay to people who work during the pandemic.
I hope so, because right now, as she's being quarantined, she's not getting paid at all.
Right.
And she went to the hospital. She don't even have insurance. But I told her, I don't care if you don't have insurance. You go take yourself to the hospital, because your life is more important than that bill that's going to come out. Me, these are my kids that are sick, and it's really, I can't even really help them, because I'm supposed to be quarantining myself. That's what I was a governor. Let me ask a question. Since we're all COVID-19, is it okay if we can party with each other to keep our mind insane? That's the least we can do. Because every time we decide that we're going to go to the hospital, they return us back home. It drives a person knowing that we're not getting the right help. So what do? We knock on each other's door and say, hey, what help do you need? Are you breathing okay? What is your symptoms? Maybe I can help you.
Yeah.
So that's what I do. I have a son that's blind. I have a daughter that's heart murmur. I have a husband that's high blood, and we're all quarantined. I'm asthmatic, but what do I do to them every single day? We come out and we talk to each other and let them everything's going to be okay. So I wanted to find out from her, is it okay if I just have a birthday?
No, you're supposed to stay home, ma'am. You're sick, stay home.
No, I'm not going anywhere. Yeah. I'm talking about having a birthday in my own house. We're just off quarantine. I'm not going nowhere, because I'd rather be safe than to use the other people this sickness, because it's not fun. This sickness is real. I will not go out there and what do you call it, jeopardize other people's lives. No, that's not me. But for me and my family, that if there's a birthday, can I have a birthday here at my own house? Because, maybe it can keep us going. This is life. Life goes on. Even if we can't taste, at least we can do something. Then for people to have anxiety, to have a hard time breathing, because maybe it could be from that. Maybe that's why people are dying, is because it's not because they couldn't breathe. Is that they were going through anxiety that nobody was there to understand that. The doctors are not really looking at it. It's not because I had it and I thought I couldn't breathe because of my lungs. But it wasn't about my lungs. It was about my anxiety that it took over, because seeing your family members go through this sickness and you can't help them. You can't help them because you don't know what to do. That's why things are happening like this, because of anxiety. Anxiety is very high. So when you have anxiety, whoever's sick out there, beat it, because it will bring you down. Because it almost brought me down. But I said, no.
Not today, anxiety. Not today.
This is not going to kill me. No way.
Well,
I have a
ma'am,
family.
continue to monitor your symptoms, okay? And we definitely thank you for reaching out. And, you know, Bree, it's so easy for a lot of people to forget when we when we do these stories and we're like, hey, if you're having trouble breathing, you know, hey, call your doctor. I mean, we're a poor island. There's so many people who don't have health insurance. They don't even have a doctor. And they're left to navigate this whole mess all by themselves, right? And we spoke to this lady before. And, I mean, when you turn positive, who tells people like that, the uninsured, what to do? Because it sounds like she's totally lost. She doesn't know what to do. Where's public health? Don't they call you and say, hey, do this, do that, this is what you do? Get a pulse oximeter?
She said she went to the hospital and she sat outside and then they gave her sleeping pills.
Yeah. But her daughter is also positive and she has, I guess, issues with the lungs. Yeah. God, guys.
And the woman has asthma.
Yeah, and she has asthma. Yeah, I don't know.
I'm not a doctor, but
I'm not a
just
doctor either.
like, sleeping pills, that's interesting.
Yeah. 7:41. Let's take a quick break.